Welcome back to Let's Talk Value podcast series. It's an honor for me today to welcome Dr. Zeev Neuwirth. Hi, Zeev.
Hey there, Verena. It's such a pleasure. It's so great to see you again.
Yes, exactly. It's great to have a couple of coming backers. That's not good English, but anyway. And particularly honored today because we're going to talk about Zev's new book. But before I get there, quick reminder for those who are first to dial in or Zoom in or listen in. My name is Verena Volter. I'm the CEO and founder of 5P Healthcare Solutions, a boutique consulting firm that tries and help to have all these people work together better that we talk about that are along the patient journey and the value chain, patients, provider, pharma, payer, policy. And I've also authored a book around this, It Takes Five to Tango, but that is not the topic today. I'm really excited because Zev's first book, Reframing Healthcare, was a big role model and example for me when I wrote my book, but also for this podcast series. And I don't know if I've ever told you, Zev, but
Mm.
you were also a role model for us with your podcast series, which I think is now going into 150 episodes, if my counting is correct.
158th next or 159th next week. Yeah.
Okay, so we're just about hitting 50, not quite today, but close. So we're following suit. So thank you very much. And I think I really want to kick us off with the title. And by the way, I need, for those who are watching, I need to show the book, Beyond the Walls. So as I think in our previous prep chat, I mentioned to you, the wall from Pink Floyd is actually an example I'm using in my teaching and in the
Oh,
book
wow.
in terms of bargaining and negotiation when I'm helping, negotiation among the 5Ps in healthcare. So I'm always using the wall, the vinyl Pink Floyd
Yeah.
disc. So I have a personal connection to your title, but you'll tell us a little bit, how did you come about this title? And then we'll talk about the book, what's in it.
Yeah. I had been, and again, thank you for having me on today. It's actually so much fun and such a pleasure speaking with you again. Um, I had written the book and I could talk, we obviously will talk more about that, but I had a title which was called a working title, which was The Future of Healthcare is Here Now. And, that sort of is a descriptive or one way to describe the book, but I didn't really like it. And then one early morning, it was probably about 3:30 in the morning, I woke up and I remembered a book I had read and I couldn't remember the title. I could not remember the author. I could just remember a yellow book. So I went through the house, tore the house apart, looking for this book literally at like 3:30 in the morning. And then, finally, at sunrise, the book was sitting like right in front of me all the time, this yellow book. And it was a book by Jim McKelvey, who was the person who invented Square. It's that little plastic thing that you stick into your phone and you swipe your credit card. So he developed that. And that was his first entrepreneurial endeavor. He actually was a glassblower and he was trying to solve a problem. How do I help my customers pay me? And that's what he created. And then from there, he became a serial entrepreneur and he wrote this book. It was, I think, published in 2020. And I'd read it when it just had come out. And in this book, in chapter 1, he describes entrepreneurs and that entrepreneurial spirit. And he said, I want you all to imagine what life was like in medieval times and imagine the city of Edinburgh. And it was surrounded, like many other cities at that time in the Dark Ages and medieval times, it was surrounded by a great wall and everyone lived inside of those walls. And he said, there were few people who decided that there was something that they had to get beyond the walls and that they had to discover, new things. And it was those people that really pushed the limits and really brought us out of the Dark Ages. And so I reread that. In fact, I quote that in the intro and to the book. And it's this notion of beyond. Now, the one thing about Beyond the Walls, which I think is really important to share, is that as I've been talking about the book lately, people have said instead outside the walls, and beyond does not mean outside. Beyond is, and I specifically wrote beyond as opposed to outside the walls, because there are people inside of legacy healthcare as well as outside of legacy healthcare that are really transforming healthcare, and they're going beyond the walls. Beyond actually is a transcendent phenomena.
Yeah.
It means making the walls irrelevant, going beyond and above, superseding, supplanting.
Yes.
And that's really what I mean by beyond the walls.
And I like, because there's I'm going to cite a few quotes
Oh,
from your book along as we go, but there's one really that is transcending the walls of the past. And that is really something I think we're going to allude to. And if I may, for the audience, I want to read something just from also from the intro. This is a collection of heroic journeys, so the book, with real life characters whose stories encourage and embolden us not to be held hostage to the mindset, behaviors, and inertia of the past. And I really like this, that you're like, in your sense, as you're describing the beyond, being inclusive with today and what's inside and outside. But so building the bridge to the theme, I know that you're standing for value-based healthcare, but also the theme, obviously, of this podcast. So what does actually value and value generation mean for you in healthcare before we dive more into the book per se?
well, I think it's really, it's really quite basic and quite tangible. So, the truth is that healthcare today, and I'm borrowing this from the hundreds and hundreds of interviews and the decade of research I've been doing in this area, but, healthcare today in America and across the globe is more complicated, more confusing, more costly than it's ever been. And it's getting worse. And, when you talk about really, really basic stuff like access to care that's convenient and doable for most people, the unaffordability of care. I mean, and this isn't like a small factor or affecting, a few million people, who don't have insurance. What we're talking about is healthcare, and let's just keep it to the United States for the moment. Healthcare in the United States is unaffordable for the majority of Americans, working Americans and their families. We know that literally it will take one major hospitalization or one major disease, and you will be bankrupt.
Mm-hmm.
The medical debt in this country is the number one cause of family and personal debt. And the statistics are so overwhelming. So the cost, access, again, whether it's access to primary care, preventive care, or access to specialty care, is getting worse and worse, and it's going to continue down that path unless we do something about it. And in terms of the complexity of it,
And so the value, what is then like what I mean, you started it a while ago with Reframing Healthcare, your first book, and
yes,
now Beyond the Walls. So what, like for the audience, because
mm,
we talk a lot about value and
yeah,
nobody knows really what that means. So in your view and what you're describing in the book, what could
well,
be the best approximation?
yeah, I mean, I'm not the best at definitions, but I think that the realities are there. The bottom line is we have to make healthcare more accessible
Mm-hmm.
and more affordable and more
Mm-hmm.
effective. Because in the end, here's the bottom line. In the end, this is not about healthcare. In the end, this is about our health, right?
Yes.
And we in healthcare forget that, because healthcare is so important to us, and rightly so. But the output of healthcare is not healthcare. The output of healthcare is
Yes.
health.
I love it.
And right. And the value proposition here would be actually, I mean, when we actually start to see health improving, and that includes the healthcare experience, I would add as well. And I think value, I'll say one more thing about it. The value proposition is different for different. I don't think that there's yes, like I just said, a broad definition or broad conceptualization, but it's also different. I mean, I think one of the tragedies in crisis, and we are in an existential crisis here. One of the crisis is really about, you look at older Americans, frail, elderly, which is the fastest growing segment of the population, already at about 65 million, soon to be, 75 million. And this demographic is going to continue to explode over the next 4 or 5 decades. So this is not like a little blip. America is aging, and it will age over the next 4 or 5 decades. And that's true for the worldwide population as well. And then you ask the question, well, given that, and given that we know that the healthcare problems of older folks and elderly, they're different than younger folks. Well, I would ask you all who are in healthcare organizations, what is your senior strategy? What do you have a senior care strategy? I mean, if you tell me that I, as an 85-year-old on 12 or 15 medications, if you tell me that I'll walk into the same exact office as a 35-year-old with the same doctor and the same staff and the same protocols and the same resources, you're kidding me, right? I mean,
Yeah.
there is no way that you're going to deliver the right care to that older person, that frail elderly. I would say the same thing about women's health. You know,
Yeah.
um,
And I
I
think what we're alluding to is actually great. What I wanted to point out also for the
yeah,
audience in the book, and I'm going to show the book again,
mm,
is really your three domains that I really love, and I would love
yeah,
us to briefly touch on one of the middle points of each of them. So literal,
okay,
conceptual, and systemic, because I think, and maybe we'll start a little bit by the back end because you were talking about the elderly population, about women's health. So
yep,
it's really kind of that notion of a health that you said, in terms of that's the value we need to work on. But in your third bucket, you talk about what I also explain as like health happens at home. So it's really this whole notion that hospitals are important for certain very acute and episodic care, and nobody will argue that.
right,
But we do have an issue of that sector much too big. And what you said, it's not tailored enough to the needs of that person in wherever they're in their life, elderly or women or whatever. So can you tell us a little bit more how you describe that actually in your book in terms of customized, contextual, and whole healthcare? What are some of the key nuggets
yeah,
that you explain to
yeah.
us in the book?
So 30
And maybe an
seconds,
example too.
I will, and 30 seconds. So when we talk about beyond the walls, as you've just pointed out that diagram in the introduction, so there's basically three domains. These are the three critical synergistic strategies that are transforming American healthcare, and we need to double down on them. We need to realize them. The first is the digital revolution, which most
Mm-hmm.
people don't understand and is critically important. The second one is the humanistic revolution. And the third one is the market revolution. And this is how organizations are partnering in new and different ways, and the whole platform revolution, which is a huge topic, which is reality, and most people have no understanding of what's happening. And I explain that in the third section. So those are the three domains, or the three critical strategies. The one you were just referencing was the middle one, which I think is the
Mm-hmm.
most important one, is the humanistic revolution. And again, this is not theory or conjecture. This is happening today. I pointed out and highlight it because we need to understand that if we don't focus on this, we could have all the digital technology we want and all the market, power we want. Where we're going is probably going to be back into the dark ages, just
Mm-hmm.
more tech enabled. And, this is what a lot of experts talk about. A lot of people I interview and talk about are concerned that we're actually heading into a dystopian future in healthcare. I don't believe that. I'm cautiously optimistic. But the reason the middle section is about the humanistic revolution, and I share example after example after example of that, is because leaders must understand that it is the centerpiece, and everything else we do has to be led by that. And I think that's key. You mentioned a couple of things, one of which is the contextual and whole health, right? Now,
Mm-hmm.
when I say contextual, most people say, okay, I know what that word means. I'm not talking about that word. I'm talking about actually a new area, a new field that 20 years of science and research, two people in particular at the VA have literally been 2 decades of highly published evidence-based medicine. They've published multiple books on this as well. And they've discovered 12 contextual factors that you must understand as a provider, as an insurer, as a medical device manufacturer, as a policy person. These, we talk about the social determinants of health, which are critical, but those are macro factors. It is very, very challenging, and it requires a big, big effort over a lot of time to change education, to change employment, to change literally the infrastructure of communities, transportation, even food security, housing. These are macro factors. There's a whole other side of it, which no one is really understanding, except these two scientists have put it on the map. And actually now it is embedded in an AI tech-enabled company. And these are contextual factors which change day to day, hour to hour. They are 12 of them. Again, 6,000 patient encounters over the past 20 years that they deeply researched to decipher these 12 contextual factors. If you don't understand these, if you don't look for these, if you don't solve for these, you will not achieve half of what you can as a provider or payer. And again, I can give examples of that. but that is that's what I mean by contextual. And I have a whole chapter in the book
Yes.
about contextual care, as you know.
Yes. And that is truly revolutionary.
Truly.
It's somehow basic, but I think it's not happening in reality. So thank
No.
you for guiding us and for telling us and sharing all the other, ways where this has been largely published and already tested, piloted, and implemented.
And absolutely. And it's all about operationalizing it and
Yes.
using the technology of digital and automation to really make it doable and cost effective. And then you mentioned the whole health movement. That's a whole, as you know, a whole other chapter in the book. And again, this isn't just like talk or theory or a nice thing to do. There are a number of different whole health or whole person movements happening in the country. The one I wrote about extensively in chapter 6 of the book in the humanistic section is the whole health movement at the VA. And again, it's remarkable that 2 chapters in my book come out of the VA. Most people, and I've now done repeated interviews with people there. In fact, I'm hoping to interview one of the senior leaders in the National VA soon. But over the past few years, they've begun to implement a whole health movement, which is very, very specific, very operational. And what they've done is they've widened the aperture. So instead of just focusing on what's the matter with you, they ask the question, what matters to you? And they've embedded that question literally in their clinical care module in so many different ways. This is a national movement within the VA. It is so well established and so well regarded that the Surgeon General this past January wrote an article about the VA's whole health movement. And he said that that should become a cornerstone of the American public health policy and public health service. And not only that, in the same month, in January of 2023, what used to be called the Institute of Medicine, which is now the National Academy of Science and Engineering and Medicine, they come out with a 400-page report. And basically, what the summary of it is that they studied this whole health movement in the VA, and they're recommending to Congress that Congress set up a institute, a center, just like CMMI, to do research and study on the deployment of the whole health movement, not just in the VA, but in the entire American healthcare system. And it basically gets down to this point that we are not widgets, okay? Patients aren't widgets, and doctors are, and providers aren't machines. We are conscious human beings. And if we don't have a sense of purpose and meaning, and if we're not engaged on that level, it's unlikely that anything's going to really work well. And so they touch that first, and they ask the question, what's really important to you in your life, and how do we connect to that? And the way they do it, and the sophistication and the operationalization of it, is a thing to behold. And I spent a whole chapter talking about that.
Yeah. And I think this is really also what I perceive your personal red thread. You're always talking about the humanistic part of it, right? It's very strongly in there. And it's basically to the essence of our medical DNA, who we are as physicians. And we just forgotten in our day jobs with all the other wrong incentives that are and administrative work we need to do. But I want to share again a couple of quotes that I think go along those lines. There's one really, it's so simple, it's shocking, on page 101. Why don't you find out more about a person before you tell them what they should be doing? And I think we all have experienced it ourselves or with beloved ones, the paternalistic culture, and it goes in the direction of the humanistic and what you said. We should, ask people what actually matters to them. And before I want to ask you a little bit about the 4-step guide or the checklist, I also want to say something that you put really the finger on where it hurts. You speak about a blind spot of what happens when the patient returns home. So it's really kind of the intersections, and it's a different perspective on the health continuum, the whole holistic, whole health movement. But I think it's also we have all those silos in healthcare among us, the 5P, but also along the patient journey. It's only a journey of walls, right? That the journey that the patient needs to jump over. So I think if you can tell us a little bit about, that 4-step guide, if you may, or we don't need to go into details, but I want to share to the audience that your book does have some really practical and detailed and examples on to learn from what happens practically and not only theory and 10,000 feet view, but there are really also a couple of checklists and guides which I think make it really practical for the reader if they want to go back and try something out new.
Yeah, I mean, I've put in a few in there. I was just thinking about one. I have a graphic, and in chapter 9 is it's called the superpowers and secret sauces of hospital systems, and it's really speaking to what hospital systems can do to sort of shift from being disrupted to being the disruptors. And I mean disruption in a good way, to disrupting the status quo and advancing healthcare. But and maybe Verena, I'll let you pick the ones you think. I think the whole book is practical because it's basically
Yes.
example after example of people who are actually transforming healthcare. You could literally lift the ideas from each of those, pick any one you want, or you could actually, look them up and go follow them or partner with them, many of them. But there are many examples of things that organizations and provider groups can be doing. I do want to say one thing, though, based on what you said a moment ago about physicians and providers. I want to be very, very clear, and I know you agree with me on this. This book is not about what's wrong in American healthcare. I really purposely did not dwell on what's wrong or the problems, because hopefully, they're well established and others
You
have
say
written.
it, break free from the spiraling negativity.
Exactly. I break free. I love that. And
You
so
wrote it.
this book is thank you. This book is about what's right in American healthcare and what we should be doing more of. That's what the book's about. And the one thing I want to say about physicians and providers and nurses and PAs and administrators and everyone in healthcare, I am in awe of the work that we all do and you all do. And the truth is the system is not working for you. I'm saying that definitively. When 50% of all doctors and nurses are burnt out, and that's not like a fanciful term, that's a scientific term. When you're demoralized, there are articles after articles by incredible experts calling this moral injury. Moral injury, right? It's not just burnout, that morally injured. That's a term that was taken from the military. It's the experience that soldiers have when they go and they fight and they are engaged in, in things that they thought they never would be or should be, and, are literally in a moral existential crisis after the fact. And they're applying this to physicians now and nurses, and that's serious. And so when we see this kind of damage to providers who are so dedicated, so passionate, so smart, so committed. I am in awe of the people in healthcare. When we see this sort of damage, and again, it's not to 5% or 10%, we're talking about the majority of us in healthcare. When you see this sort of burnout, this moral injury, you have to understand that the system is not working for anyone. Maybe it's working for a few people who are making a lot of money off of it. I don't know. I just don't think that's justified. And so I think we have to change the system. We are in an existential crisis. And I've decided, instead of talking about the problem or dissecting the problem, I've decided to look at the divergent people who are actually creating solutions. And because I think that's how we get to the solution, is by, there's a phrase.
And thank you so much for really being so clear on your, and really outspoken. And I guess there is a commonality on your motivation, my motivation, why we do this, for our peer group, for patients, for anybody in the system. And I really like what you say. People working within healthcare have an intrinsic motivation to serve others. And we really need to pull that back to the surface, because, as you said, it's with all the other thing, that's going on, and people, as you say, that the system doesn't serve those people that want to do good and serve others. So, and this is, I think, why you and I and many others join forces. We have to continue and change the system towards more humanistic and patient-centered work. And I think what Steve Klasko says in his testimonial, being optimistic about where it can go, is, I think, really what this book is about. And I think that, again, the practicalities for the reader, I think, is important. I want to lead us towards closing out too, and that's always the problem with these sessions, right? They're always too short. But really, obviously also full circle with what we do and I do at 5P is like helping bridge all those different interests along the way, because they might be some of the root causes on why it's so broken, why the costs go up and people burn out. So you speak about really the mindset shift that needs to happen. So yes, we need to help and put all the guardrails and rules and regulations in
Mm-hmm.
place, policy, whatnot, payment models, but we also need to accompany the mindset shift. It's different to be collaborative in the ingoing intention than to say, I want to safeguard my bargaining power and make the most profit out of it. And this is how we've been trained and grew up in the system,
Mm-hmm.
fee for service. You sell services, that's your incentive. Well, then you sell services. You don't
Mm-hmm.
look at the patient. So any last comments around novel partnerships? How do we do this? Create new partnerships and work with people we're not used to work with in the old system. So, because I know the theme of partnership and mindset is really important for you, and it comes through in the book.
Mm-hmm.
Anything you want to share on those
Well,
notes?
yeah, no, thank you for asking. I mean, again, I have a whole chapter on the novel partnerships and collaborations, and very, very concrete example after example after example. In fact, I have a chart with, sort of the categories of new partnerships. One example is, the idea that, in the past, hospitals would have to merge with each other, or one had to acquire another one to come together. What we're seeing now is really novel partnerships between hospital systems where they're saying, no, let's come together on a new startup, or one focal idea. Whether it's like hospital at home or home-based care, or virtual care. Let's pool our resources. And in fact, you're starting to see coalitions of hospitals come together. A great example is Civica RX, which is revolutionary, right? It's basically a number of hospitals that got together and they said, you know what, we're not going to be held hostage by the pharmaceutical industry. We're going to start to actually manufacture generic medications and, get them to patients at a lower cost. It's kind of like Mark Cuban's thing, but it came before Mark Cuban, his Cost Plus company. And it's absolutely brilliant, and they're doing exceptionally well, and they're growing, and they're really making generic medications, and now they're getting into even non-generic medications, I think, available to the American public and to a huge swath of the American public. So that's an example of a collaboration, and again, there's a couple of others that are like it. Truveta was one where a number of hospital systems come together to pool their data instead of selling their data separately, or someone buying their data. And they're saying, no, let's use this for real science and research and to really help people. And let's keep it within our healthcare systems. There's a new one called Graphite Health, which is looking at, it's very hard for hospitals to really understand digital and acquire digital companies and evaluate digital companies. It's, there's so many out there. So they're saying, well, let's get, hospital systems in a collaborative together. Let's pool our resources so that we can actually, and even work with some vendors to really understand, how do we evaluate this whole new digital revolution and these digital companies? So that's just one category, but I have multiple categories in chapter 9, which really explains these novel collaborations, and I can go on and on about it.
No, but I think it's great. And I like what you said, like around one focal idea, because I think this is also what makes it then practical and simple. And maybe that's tips and tricks for people as of tomorrow to start thinking. Just start with one thing, around one idea, and then see. And I like the second thing that you said, pull the resources. So really kind of, you can't know it all. So look with, you said, be it a digital startup, be it a manufacturing, medicines, whatever it is, your idea, and then pull in the people, because, no one can do it alone along the 5P value chain. And I think we're even in Europe now, we're seeing more and more actually novel partnerships that involve not only a health system, but a payer, right? And I know in this country, in the US, it has been going on for a while, but it's spreading, like wildfire outside also, to like really have cross-sector novel partnerships around one focal idea. I really want to
That's right.
retain that.
That's right.
And pull the resources. And I want to throw in a third maybe dimension that we've learned from the pandemic is sharing risks, right? That's the power of the novel partnerships, because you don't need to carry all the cost and the risk. You can actually share it maybe with others. So I think
no, even CINs are an example. Clinically integrated networks are an example of that. But I think we're going to see beyond CINs, and some of the partnerships that are emerging right now that I'm aware of, most people can't even imagine or haven't even heard of yet. So lots going on.
Thanks for sharing all those real examples from your up to 150 podcasts and conversations beyond your podcast. So, Zev, before we close, any last comments you want to hand over to our audience that are listening in, be it physicians, hospital administrators, we have pharmaceutical company leaders, startups, anything you want to share as words of encouragement other than read your book?
Yeah, no, I think the thing I want to point out is that I think the journey I've been on and the book that I wrote is really a lesson in learned hopefulness. And I think that most providers, most leaders are really stuck in learned helplessness right now in healthcare across the board. It's like, what can I do? What can we do, et cetera? And, this has been a very, very personal journey for me. I think I could have been, like many of my colleagues, jaded and burnt out and really pessimistic about the future. I'm not. I honestly am unbelievably hopeful and optimistic. And the reason is because I've learned hopefulness and now I'm sharing it in the book.
Thank you so much, Dr. Zeev Neuwirth.
Thank you,
Bye-bye.
Karina. Bye-bye.